Your health is the most important thing you can invest in. Hey guys, this is Dr. Brenden Cochran coming to you from Interactive Health Clinic. A little bit different view, angle, camera, I know, but I had to bring this out today. How bad our science really is what I'm going to topic this. So before I get into that, a little bit of info on what's going on. Okay, we have lots of riots, we have lots of protests. Things are kind of crazy right now. Lots of people in close contact. So one of the things that we are concerned about is this thing going to launch? And right now we know the fastest spread of COVID, we look at the R naught, which is basically the R naught is how quickly is it spreading to other people. Remember, if we keep that R naught below 1, it typically dies out and it fizzles, right? If it's above 1, we typically have progression of spread of this virus. So currently, number one situation you'll see right here is North Carolina has an R naught of 1.38. Then it's followed by Georgia, then Montana, and then Washington State. And then it goes down the list. Ones with the lowest R naught right now are Alaska and Hawaii, which should be because we're not doing a lot of travel in those areas. But however, also done a really good job with New York, New Jersey are also very, very low as well. And they've been on very tight lockdown so far. So we have some movement here. The other concern that keeps coming up is this going to burn out of the summer and come back, or is it not? And, we know this thing doesn't seem to be affected by the weather. Otherwise, we wouldn't have seen it blow up in Brazil like it did. The other thing we have to remember, most people during the summertime, when it's hot, muggy out, usually are not outdoors all the time, where this thing would fizzle and die off. But most people are indoors, in with the air conditioning, and clearly getting exposure with air conditioning. So that is also very concerning, and it could fester some spread. However, with the current numbers that we're seeing, this thing takes a while to gain traction. So is it going to come this summer, or are we going to see something in the fall? Our guess is probably something in the fall, but we'll see. We'll see what happens from this. Okay. So now let's get into the science, right? The bad science behind this. So quickly before that, this goes back to hydroxychloroquine. I believe, and I've seen enough articles and enough countries that are using it properly, it may be helpful as a helpful drug. Again, I don't like to use drugs unless I have to. And again, we've talked about other natural means of increasing zinc ionophores. This would include green tea and quercetin. You can look at that at some of our past videos. However, if you need a stronger zinc ionophore that does seem to show a lot of clinical evidence, we are talking about hydroxychloroquine again. Now, the New England Journal of Medicine did release recently that a randomized controlled trial that hydroxychloroquine is not a post-exposure prophylactic for COVID, meaning if you were exposed to COVID and you started taking it, it would prevent you from getting the coronavirus or COVID. And I agree with that. The drug has never been touted as a prevention of getting this virus. Best thing for prevention of this virus is literally hygiene therapy is number one, and also having an ideal terrain so you can handle this thing when it does come in, and reducing the amount of particulate matter when it comes in. And that has to do with masks. That has to do with boosting your immune system with things like zinc, elderberry, and also things like quercetin, NAC are also on that list. And we mentioned many other things that you can do as well. So how about this thing about the treatment of coronavirus or COVID-19? Well, here it comes. I told you this, that there was too much financial and political BS in the Lancet study that came out that then influenced everybody else. Well, 2 days ago, the World Health Organization decided to continue on after they suspended their trials with hydroxychloroquine, which was intriguing, right? It's like, okay, good, we're going to get some more research out of this. That's what we really need to see. And then, as of today, look, live updates. Authors retract study showing hydroxychloroquine was dangerous to hospitalized COVID-19 patients. Boom, boom. What a corrupt study that was published in the Lancet. They basically went on and looked through this, and they said that as a result, they concluded that they can no longer vouch for the veracity of the primary data source. They can't vouch for the data source that was provided there, right? They have no audit proof system. They can't say that those results that they got from their source were accurate. They have basically they're unable to complete an independent audit of the hospital data that was collected for that analysis in that particular study. So therefore, when they can't do that, they say they don't have enough research to suggest that the claim that they made was correct. So now we have a very large journal, Lancet. It should have never been published in the Lancet. I clearly think this has to do with a political left-right battle versus up-down logic, right? And good science. Clearly, we saw this coming. We saw it retracted. So now we have yet a large journal retracting a statement saying that it was dangerous to these particular patients. And that is what we're seeing. We're seeing very crappy, very poor science being done right now and being pushed for a political game or a financial gain, right? Especially when remdesivir has 2 trials showing that it reduced no mortality in patients as well. Yet we have pushed that therapy. So why don't you take a look at this just to see this short video today, just to show you that research is often manipulated to get results that we want to do. We do that highly with natural medicine, where we'll take an individual natural ingredient, give a poor therapeutic dosage, or do a trial like that, manipulate the statistics so it looks like it fails. We will do this with statistics all the time. We'll do this with analysis all the time, where we'll make this big announcement on the news or front page saying that natural medicines don't work, or we'll say that this didn't work. And if you dig further or you follow the study further, you'll find there's some financial gain or there's some political backing to bash another group. And that really does happen in medicine. Unfortunately, what we have to now do is most of the articles that us doctors, if again you are a doctor which keeps up with time, and there are some people out there that don't do that, not because they're being mean or malicious, because oftentimes they're too busy to look at these things, and criticize these things. And this is another prime example of an article that you had to read through and criticize it. And then finally, after doing that for the last week or so, as you've heard me talking about, it has been retracted. So we do this with everything we look at. That's why, I had a patient this week came in and they said that their oncologist told them that if they're doing vitamin C during this particular chemotherapy, it could reduce the effectiveness of that chemotherapy. And I hear that all the time, yet I have a whole database of talking about IV vitamin C and being helpful and not interfering with chemotherapy and being synergistic with the patients. Here, that is the hardcore research. I can give papers to patients on that. So when I hear that type of stuff coming from another provider, it tells me that the other provider has clearly not educated themselves and is coming at their patient with a fear-based tactic versus a research-based tactic. And so anytime you are given any skeptical medical advice from anybody, a provider, from anybody that you want to question what's going on, you really need to ask them, is this a theory? Is this based on science that you're extrapolating? Because sometimes we do treatments in medicine that we extrapolate from research. And I try to be very transparent with people when that is and when that isn't. When somebody makes a comment like that, for example, that clearly indicates they don't understand the medicine. And I asked if that is true, please ask them to provide you with a medical journal or article that clearly shows that doing vitamin C IV with your chemotherapy is harmful for you. And most of the time you'll find that if you confront a practitioner and ask them for that data in your findings, if they cannot provide that for you, they're blowing smoke up your chimney. All right. And they're trying to add a scare tactic, which I don't know why people do that scare tactic, because what we're trying to do is do everything we can to get you guys better, right? That should be the ultimate goal, not just badmouth somebody else because I don't understand anything. The goal is to get you guys better, so it doesn't help productively when we have some other profession saying that this doesn't work or this will harm you when they don't have the data to back that up or they've never consulted with you. And I think that mentality is showing through right now. If you guys haven't seen this already, it's showing through in our media. It's showing through in our research-based medicine that lacks research and instead is financially driven. We have lost a lot of our ethics in medicine, and it's very disturbing to see this as it continues to happen and it continues to shape our recommendations that we publish in medicine. Why should a person take this medication? What is the actual risk reduction that they're going to achieve, and at what cost? And all that needs to be discussed versus saying, well, this group made this recommendation, you need to take this. And again, we see that retracted. We see those things change. People can't make those claims, make those cures, and then attack other people for making claims as well. It's just not right. Anyways, hope you guys are doing well. A little proactive medicine for you. Again, my goal with everyone and every patient is to provide the best information I can, cutting edge medicine, whether with an integrative blend between them, so you have the best knowledge to make the best decisions. But ideally, we like to do that with something called proactive medicine, which means we get your health in order and attack that first before it becomes a big disaster later, and it costs you just so much more money, so much more heartache. All right, guys, hope you like this content. Again, remember, share this content, hit the like button. If you have anything you want me to go over or talk about, please let me know. You have a fantastic weekend. This is another really good incentive to invest in your health. Investing in your health is the best thing you could ever invest in.